a 66-year-old male here for pretty severe pain over the anterior left knee. He had a similar thing maybe 10 years ago. It sounds like he had a Gouty Bursitis. Sounds like he has something similar now. He's a little bit of erythema. He's quite tender to touch over the anterior patella with some swelling. So again, he may have a subcutaneous infrapatellar bursitis is my guess going into this. Here we are looking at the patella in a sagittal plane. We can see this hypoechoic darkened area, which I believe is directly over the prepatellar quadriceps continuum, which you can see here, which essentially overlies the patella and proximal patella tendon. This is where he's quite tender. And if you look at the patella tendon on the superficial aspect, there's these bright hyperechoic linear signal, which may be small tophi over the patella tendon, perhaps in a very small subcutaneous infrapatellar bursitis, where he is also tender, but more of his pain, I believe, is over the patella itself. Here we are now looking at the patella in an axial plane. You can appreciate that thick tissue over the patella, which I believe is again a prepatellar quadriceps continuum, and over that is this prepatellar bursitis, which is more of an isoechoic bursitis. There's really no significant compressible fluid within this bursa, but again, this is where he's quite tender, and there may be small tophi perhaps in this bursa, which I cannot really appreciate on ultrasound. Now we're just toggling over the patella tendon, and here we're looking at the distal quad tendon. This patient does have some calcification within the quad tendon itself, perhaps linear calcification versus a superior patellar pole enthesophyte going into patella tendon. You can appreciate the prepatellar quadriceps continuum over this enthesophyte or calcification. And now we're starting the procedure. This is an in-plane approach. We're going from proximal to distal. Here you can see the needle tip going in, essentially just on the skin. It's almost like a subcutaneous type injection that we're doing. You can see the needle tip essentially within this isoechoic prepatellar bursa. And now we're starting the injection. You can see the injectate kind of filling up that bursa, and we'll be able to advance the needle a little bit distally. And here's again the end of the injection with a flash of air going throughout this prepatellar bursitis.